Now is good.
On today's episode, we are going to dive into what hormone therapy is, and I'm going to ask Julie all of the burning questions that we've all been dying to know. Hi, Julie.
Hey, how are you?
I'm good. How are you?
I'm
Excited.
good.
Good.
Yeah, it's a hot
Okay.
topic.
Hot topic. Hot topic.
Mhm.
Let's get into it. So let's
Yeah.
start with the basics. Julie, what exactly is hormone therapy?
Okay, so hormone therapy, or also known as HRT, hormone replacement therapy, is a treatment that is used to restore hormone levels in the body when they become imbalanced or drop too low. We see this with people who are in perimenopause, menopause, and for men, it's called andropause or low testosterone. Sometimes it can be due to medical conditions or surgery, but essentially it is replacing hormones that are too low in the body.
Wow. Who typically benefits from hormone therapy?
Well, I like to say that, there's hormone imbalances come from all over in terms of age. We typically see people in their, 40 plus age range, but there are young women out there who have different hormonal imbalances, like PCOS, where they have a hormone imbalance and they need um, hormone therapy to help with that imbalance. Typically, we see people 40 plus, men and women.
Wow. I would have never thought men. So do you see a
Yep.
lot of men, Julie?
Yeah, I would say I see it's almost 50-50.
Wow.
It's yep, yep,
That's really cool. So, what are
yep.
some of the different forms that hormone therapy can take?
So hormone replacement therapy comes in a varied range of different forms. You can take pills, you can do creams, gels, injectables, you can do pellets, a thing called troche. Some people are familiar with troches, patches. So, depending on the person, depending on the age and their, compliance, the forms of therapy varies for person to person.
Okay. So, I know that there are many misconceptions surrounding hormone therapy. What are some of the common myths that you encounter?
Oh, geez. So, Uh, there's a ton of misconceptions out there about hormone therapy, which is very unfortunate for a lot of people. I see a lot of people who struggle in perimenopause, and the misconception is for a lot of these women is that their symptoms need to be severe for them to get treatment. Um, and I look at people like if you're having issues with sleep or you're having issues with mood imbalances, weight gain, different things, then I feel that hormone replacement would be a good option. So I don't tend to only treat for severe symptoms. I treat people based on, you know, different other categories, I guess, like low libido, things like that, things that typically you wouldn't seek hormone replacement treatment for. Um, you also hear a lot of talk about how hormone replacement therapy causes cancer. Um, and that came from a study, oh my gosh, over 20 years ago, which is a study where, they looked at women and hormone replacement therapy. It's an unfortunate study that has been debunked. But what came from that study is that they said that it caused uh, breast cancer in a lot of women. And so that fear has continued to stay around. Like I honestly, I have patients that ask me. I had a patient that asked me last week about cancer in her family, and that is a misconception. Um, Another misconception that I hear, so I'm starting to see a lot of women, patients ask for testosterone therapy. It can help with low libido. It can help with muscle loss with women. And there is a misconception out there with testosterone therapy that you're going to grow a beard, you're going to grow a mustache, you're going to have all of these things. And that, Heidi, to me, is a big misconception. I think that testosterone is a great treatment for females. So those are probably the common things that I see and hear.
Mhm.
Yeah.
Okay. And how does hormone therapy help in managing hormonal imbalances?
Um, well, when it comes to hormonal imbalances, especially in perimenopause, with women, it helps with restoring, the balance that a woman had when we were in our 20s and 30s. So, when you start to go through perimenopause, it presents in so many different ways for different women. And, it can be just the mood, just when we talk about mood, I don't mean just depressed. I mean like every little thing bothers you that
Mhm.
didn't bother you before. Like I had a lady the other day, and it was so funny because she was like, so will this help with, when I'm laying in bed at night and my husband is eating and we're watching television and every little sound I want to like, she's like, I've never had these thoughts before. And it's like little things like that. It's like little things that didn't bother you.
Mhm.
Kind of, they're so exaggerated to the point that you feel like, you're almost going crazy. Like,
Yes.
why do I feel this way? So it's like it helps with managing, I feel like the sleep, the mood, the energy levels that we once had. Um, Another big thing that you hear about with women are like the joint issues. Like
Mhm.
this same lady who I saw last week had frozen shoulder. And, frozen shoulder is something where, if you haven't had an injury, if you're not an athlete and, all of the things where you've had
Mhm.
repetitive injuries to like a shoulder, why do I now have a frozen shoulder? Like,
Right.
why did this just all of a sudden happen? And for a lot of women, it's due to hormone loss. It could be testosterone, it could be estrogen loss. Um, they go see, their medical providers. They want to do injections. They want to do, physio, all these different types of treatments when the root cause is loss of hormones. So
Wow.
it's things like this where we're not aware sometimes that hormones play such a big part in how we feel day to day. So managing symptoms is like, it depends on the person, it depends on what's going on, but it can help with so many things.
Wow. Wow. So, do you believe more in optimizing hormones or just a band-aid approach?
So, so there's different school of thoughts out there when it comes to hormone therapy. So a lot of medical providers, like I said earlier, are trained to treat more severe, like hot flashes, night sweats, things like that.
Right.
And it's almost like, well, I'm just going to give you a little bit. I'm
Mhm.
just going to prescribe just enough to make sure that one or two symptom goes away.
Right.
It's not, well, gee, if you give me a little more, maybe my sleep would be better.
Right.
Maybe I don't need to take an antidepressant. Like Hormone optimization is a total different world where we look at lab values, but we want to improve your labs. We want to improve your levels. We want kind of all of the symptoms to go away so that your quality of life is improved and you feel like you were back in your 20s and 30s. That's the goal of hormone optimization.
That is amazing. Thank you so much, Julie, for all your insight. This is such a vast topic. What
Mhm.
can viewers look forward to in our upcoming episodes?
Yep. So, next week on our podcast, next week, we want to talk about menopause and mental health. I think this is another very underserved population where, the treatment options may not be ideal. So, next week will be all about menopause and mental health. And I just want to thank all the listeners out there for tuning in this week. And if you want to follow our Instagram, Facebook page, we also have this shared on YouTube. So share our podcast with all your friends and anybody that you feel can benefit.
Thank you. Thank you so much, Julie. That was amazing.
Thank you, Heidi.